Good evening, everyone. I hope you can hear me and see me properly. Good evening, everyone. I hope you can hear me and see me properly. Good evening, everyone. So today we will be discussing certain questions which were asked in this year FMGE December exam, and all the questions, remember, they were very simple, just a little bit tricky one. They were tricky, but they were not difficult actually. So if you have very good concepts, good knowledge, you could have easily marked all the questions very easily. And the questions which I saw were not from very rare disease. They were mainly from the commonly asked disease like diabetes, antipsychotics, you can say main infections. So the questions were very simple, and this is the same pattern of the questions which is commonly asked in AIIMS exam, INICET exams, NEET exam. So the pattern of the question is similar in all formats of exam, whether it is FMGE, INICET or NEET exam, they are same. So you should have a thorough concept, then you can clear, I think you can clear any exam if you have a thorough concepts. So okay, so let's start with the recall session of all the questions of pharmacology, and I'm Dr. Ankit. So it's so nice to meet again. So let's start with the first question. The first question which was asked was a 50-year-old patient of type 2 diabetes. So again, diabetes is an important topic. It was controlled on oral hypoglycemic drugs. This patient presented to hospital with hypoglycemia. So it means the patient was taking some anti-diabetic drug. Now the patient is having hypoglycemia. So which among the following drugs can result in hypoglycemia in this patient? So they are simply asking that which anti-diabetic drug causes hypoglycemia. Remember, there are only 3 anti-diabetic drugs. We have made a list, beautiful list in our notes also. There are only 3 drugs in diabetes which can cause hypoglycemia. Okay. So these 3 drugs are, the first one is insulin. Don't you think it's very logical? If we will give insulin high dose, it will cause hypoglycemia. The second drug is sulfonylureas, and I will tell you the reason for this also. Sulfonylureas. And the third drug is megalithinites. These are the 3 drugs in diabetes which causes hypoglycemia. Insulin, we all know, will cause hypoglycemia. Sir, what about the other 2 drugs? Remember, these 2 drugs which causes hypoglycemia, these drugs are known as insulin secretagogue. These drugs are known as insulin secretagogue. Why? Because these drugs, they increase insulin secretion from beta cells of pancreas. So first is insulin, the other 2 drugs, they promote insulin secretion. So very logical. Apart from this, no other drug will cause hypoglycemia. Now what are the names of sulfonylurea and megalithinites? Sulfonylurea, remember, they are of 2 types. Either they will end with the word amide, or they will start with the word gly. And megalithinites, they will end with the word glenide. So this is a trick how to remember. So if I will ask you any sulfonylurea which ends with the word amide, can we write chloropropamide? It was the first sulfonylurea to be made. Tolbutamide. So you can see they are ending with the word amide. And any drug which is starting with the word gly is also sulfonylurea, like glimepiride, glipizide, gliclazide, and many more are there. And lastly, any drug which ends with the word glenide is a megalithionide. So only two drugs are there, natiglenide and repaglenide. So this is the complete list of the drugs in diabetes which causes hypoglycemia. And now it has become very easy for you how to identify them. Either they will end with the word amide, or they will start with the word gly, or they will end with the word glenide. I hope it's simple. So can you tell me the correct answer? The correct answer for our question is glipizide. So the correct answer for our question is glipizide. Simple. You are all the students who have written the answer, they all are right. Okay, let's come to the next question. A patient is taking platinum-based anti-cancer therapy. Anyone who can answer any drug which is a platinum-based anti-cancer therapy, like cisplatin, carboplatin. So they will end with the word platin. Carboplatin. So they all are ending with the word platin. Oxaliplatin. So these drugs which end with the word platin are anti-cancer drug. Okay? And they are platinum based therapy. For the treatment of ovarian cancer, I will teach you later on that ovarian cancer drug of choice is cisplatin. Which of the following drug should be used to prevent nausea and vomiting in this patient? Okay, so before coming to the answer, remember one point, that cisplatin, it is the most emetogenic anti-cancer drug. Which is the most emetogenic anti-cancer drug? Cisplatin. Cisplatin is the most emetogenic anti-cancer drug. So the drug which is most emetogenic anti-cancer drug will cause maximum vomiting. And remember one point, vomiting due to anti-cancer drug is known as CINV. Vomiting due to anti-cancer drug is known as CINV, that is chemotherapy induced nausea and vomiting. Okay? This condition is known as chemotherapy. Now what is the answer for our question? The answer of our question is palonosetron. The answer for our question is palonosetron. So let's see which antiemetic drugs are given for the treatment of chemotherapy induced nausea and vomiting. Anyone, what is the vomiting center of our brain? Anyone? What is the vomiting center of our brain? The vomiting center of our brain is known as CTZ area. The vomiting center of our brain is known as CTZ area. This is the vomiting center, chemoreceptor trigger zone. Now remember, on CTZ area we have one receptor, 5-HT3 receptor. Agree? On this 5-HT3 receptor, serotonin acts, and serotonin increases vomiting. Okay? We have one more receptor, that is Nk1 receptor. On Nk1 is neurokinin, substance P acts, and substance P increases vomiting. Third, we have CB1 receptor. On CB1 receptor, cannabinoids act. Cannabinoids are produced in our body, but remember, cannabinoids, they decrease vomiting. Cannabinoids, they decrease vomiting. So can you tell me, if you want to stop vomiting, which drug we should give? The first class of drug we give is 5-HT3 antagonist. And these drugs, they end with the word cetron. These drugs, they end with the word cetron, like ondansetron, granisetron, tropisetron, and the answer of our question was pelonosetron. I think this was the answer, pelonosetron. Then we have Nk1 antagonist. The next one is Nk1. Nk1 name is neurokinin. These drugs are known as pitant. These drugs are known as pitant. These drugs, they will end with the word pitant, like aprepitant, fosaprepitant. A for aprepitant I am writing here. Netopitant. So you don't have to remember their names, you just have to identify them. And rolapitant. ठीक है, simple हो गया काम. Very good. Third drug we should do is CB1 agonist. Don't you think we should stimulate CB1 receptor? CB1 agonist. So these drugs are CB1 agonist. You can see that in cannabinoid NABI word is coming. So these drugs will have NABI word in them. इनमें NABI word होगा. Example, nabilone and dronabinol. You can see that in dronabinol also NABI word is coming. So I think now it's very cakewalk for us. Very easy to remember now. You have to find NABI word. There is one more drug which is given for CINB. Another drug for CINB is corticosteroids. The reason is corticosteroid, they decrease the production of serotonin and substance P, which are inflammatory mediators. Corticosteroid is also given for the treatment of CINB. Example of any corticosteroid? Yes, dexamethasone. So this is the complete treatment of CINB, chemotherapy induced nausea and vomiting. And no question will come beyond this ever in any exam. Okay, let's come to the third question. In a patient of pregnancy induced hypertension, drug used in the treatment is anyone? The answer for this question is alpha-methyl dopa. Okay. So first point, in pregnancy induced hypertension, which drugs can be given? Which drugs are approved? So we will write a mnemonic for that. Mother, cares baby during her pregnancy. So these are the drugs which are approved. M for alpha-methyl dopa. Second is clonidine. B for beta plus alpha blocker, like labetalol. D for DHP type of calcium channel blockers, like nifedipine, etc. All class. H for hydralazine. and P for phentolamine. Phentolamine is an alpha blocker. Hydralazine is also a vasodilator. These are the drugs which are approved for. So, which drug can be given? The answer is alpha methyl dopa. But the question is, the drug of choice for pregnancy induced hypertension is labetalol. Earlier the drug of choice was alpha methyl dopa. Now the drug of choice for PIH is labetalol. Now what about this spironolactone, lisinopril and telmisartan? Remember, these drugs are RAS inhibitors, renin, angiotensin, aldosterone inhibitors. Remember, RAS inhibitors like spironolactone, lisinopril, which is a separate topic I will teach you, they are absolutely contraindicated in pregnancy because they produce renal agenesis. So remember, any drug which ends with a word pril, this is the most commonly asked, never given in pregnancy. Lisinopril, ramipril, captopril, any drug that ends with the word sartan should never be given in pregnancy. Telmisartan, candesartan and spironolactone, which is aldosterone antagonist, should not be given. Okay. Let's come to the fourth question. A female was treated with clindamycin and she developed diarrhea, and this diarrhea was pseudomembranous colitis. Agreed? So which bacteria causes pseudomembranous colitis? The answer for this question is Clostridium difficile infection. Clostridium difficile infection. Very simple and easy question. We have discussed it many times in our notes. Many times. So the highest risk of causing pseudomembranous colitis is by clindamycin. Why pseudomembranous colitis occurs? Because in our colon we have good bacteria, symbiotic bacteria. So when you give clindamycin, this clindamycin kills good bacteria. It kills good bacteria, and this harmful bacteria then grows. Which bacteria then grows? Now this harmful bacteria grows. So that is why it is known as pseudomembranous colitis. We know that Clostridium tetani causes tetanus. Purpharinges causes gas gangrene, which is also known as myonecrosis. And septicum also causes gas gangrene and myonecrosis. Okay. So the answer for this question is Clostridium difficile. Fifth, what is the mechanism of action of doxycycline? Let's see. DNA gyrase inhibitor? No. DNA gyrase inhibitors are fluoroquinolones, which I will explain you later on. Fluoroquinolones, they end with the word floxacin. Can you name some fluoroquinolones? Ciprofloxacin, ofloxacin. Cell wall synthesis inhibitor? No. Cell wall synthesis inhibitors are penicillins, cephalosporin, carbapenems, vancomycin. So there is a proper mnemonic which we teach in our class. Check out vancomycin. DNA dependent RNA polymerase inhibitor? No. The drug here is rifampicin in TB. So the answer for this question is protein synthesis inhibitor. Remember, doxycycline, any drug which is a doxycycline is a class of a drug, tetracycline. Example, doxycycline. Doxycycline is a protein synthesis inhibitor. Any other drug which is a protein synthesis inhibitor apart from tetracycline, we will write aminoglycosan. aminoglycosides, macrolides like erythromycin, azithromycin. So there is a big list and there is a way how to remember them also. Okay? Aminoglycosides like streptomycin, kanamycin, etc. So there are many other drugs which we'll discuss. So the answer for this question is protein synthesis inhibitor. Okay, yes, Kush Avasthi knows the answer. Very good. A 56-year-old patient who is a known case of hypertension was being treated with antihypertensive drug. He is having chronic cough. Remember, who will tell me which antihypertensive drug has a side effect of chronic cough? Which antihypertensive drug has a side effect of cough? He was started on antimicrobial but cough did not resolve. That means it is a non-infective cough. There will not be any infection. So that antihypertensive drugs increases bradykinin level. Because normally bradykinin is degraded by, bradykinin gets degraded by an enzyme, ACE enzyme. So if you inhibit ACE enzyme, the level of bradykinin increases. Bradykinin causes cough. Very simple question. So the drugs are ACE inhibitors. ACE inhibitors, they increase the level of bradykinin. Bradykinin causes cough. And all ACE inhibitors, they end with the word pril. All ACE inhibitors, they end with the word pril. Absolutely right. So the answer for this question is lisinopril. The answer for our question is lisinopril. Okay, good. Next question. A 30-year-old man traveled to Assam. After coming back to the hometown Delhi, he developed fever, chills, rigors, and this is very important, altered sensorium. Don't you think altered sensorium is a dangerous thing? The peripheral smear demonstrated Plasmodium falciparum. So the patient is having malaria and the patient is having some emergency. Because of emergency, this malaria is known as complicated malaria. This malaria is known as complicated malaria. Don't you think this patient requires hospitalization? And as this patient is having altered sensorium, requires hospitalization, don't you think this patient needs IV drug instead of oral drug? So the drug of choice for complicated malaria is IV artesunate. We very well discussed. So the drug of choice for complicated malaria is IV artesunate. If this option was not given, altered sensorium, only fever, chills and rigors are given, then the answer, if the patient is not having complicated malaria, in that case, you would have given ACT. ACT is artemisinin based combination therapy. Now the patient is coming from northeastern state. The patient is coming from northeastern state. So in northeastern states, we will give in ACT, if the patient is having no complication in northeastern state, we give a combination of two drugs, Artem ether plus lumefantrine. These drugs are given orally, but the patient is having complicated malaria, patient needs hospitalization, so you will give IV drug. The answer for our question is IV artesunate. So there is a proper guideline and protocol that which drug to be given in which case, that we will discuss later on. Yes, Kush Avasthi, you are absolutely right. A patient with chronic obstructive pulmonary disease, COPD. We know that in COPD, the patient suffers from bronchoconstriction, asthma-like symptoms. He is on salmeterol therapy. What is salmeterol? Salmeterol is a beta-2 agonist, which is a bronchodilator. But there is no improvement. Which drug to be added? You will write now, if there is no improvement, add another bronchodilator, anticholinergic. If there is no improvement, add the third bronchodilator, theophylline. If still there is no improvement, add the fourth bronchodilator, magnesium sulfate. So remember, this is mnemonic is Batman. Batman are the bronchodilators which are given in the treatment of COPD and asthma. So this is the order of giving bronchodilatory therapy. So anticholinergic drug like tiotropium, oxytropium, a new drug umeclidinium, theophylline, you can write etophylline, aminophylline. Beta-2 agonist, we have already written here, salmeterol. So which drug would you like to add? Yes, now you know the answer, tiotropium. So if one bronchodilator is not able to control, add the second bronchodilator, give combination. So remember the mnemonic Batman. Simple? Good. A person is coming to emergency in comatose state. First point. After consuming some unknown poison, excessive sweating is there, and the patient is having bradycardia. Agree? Which of the following is the treatment? Remember, if the patient is having increased secretions like diarrhea, increase in secretion, urination, increase in secretion, sweating, salivation, lacrimation, increase all secretion, ठीक है, plus decrease in heart rate, bradycardia, plus pinpoint pupil, that is meiosis. This hints towards the poisoning of, what is the poisoning? This is a poisoning of a cholinergic drug poisoning. Because cholinergic drug, they increase acetylcholine. Acetylcholine acts on M3 receptor, muscarinic 3 receptor, which is present in intestine, bladder, glands, M2 receptor, which is present on heart, which causes bradycardia, M3 receptor present in eyes causes meiosis. Can you name some anticholinergic drug whose poisoning is very common? Example, organophosphate. Organophosphate poisoning will have same feature. Carbamate poisoning will have same feature. So this is a typical case of organophosphate and carbamate poisoning. So the treatment is give a drug, anti-muscarinic drug. The drug of choice for cholinergic poisoning is atropine, because atropine blocks all muscarinic receptor. Atropine blocks M1, M2, M3 receptors. All receptors are blocked by atropine. So atropine is the drug of choice for cholinergic drug poisoning like organophosphate, carbamate, because atropine blocks all the muscarinic receptors. So the answer for this question is B, atropine. ठीक है, आगे बात करते हैं. Next is a patient developed tuberculosis. Okay. With mycobacterium resistant to rifampicin, isoniazid, kanamycin and levofloxacin. This TB is referred to as. So let's see the definitions of TB. Remember, first is MDR TB. MDR is multi-drug resistant TB. The definition of multi-drug resistant is the TB which is resistant to isoniazid plus rifampicin. This is the definition of MDR TB. Next we have is XDR TB. Next we have is XDR TB. XDR is extensively drug resistant TB. So what is the definition of XDR TB? XDR is MDR plus, MDR means isoniazid, rifampicin plus fluoroquinolones resistance plus injectable aminoglycosides different. This, so we will add two other drugs, fluoroquinolones and aminoglycoside. Can you name certain fluoroquinolones you know? All end with the word floxacin, like levofloxacin, gatifloxacin. There are 3 fluoroquinolones which have been approved in TB and moxifloxacin. What about injectable aminoglycoside? 4 drugs which have been approved are SACK, streptomycin, amikacin, capreomycin and kanamycin. So if a TB is resistant to isoniazid and rifampicin, fluoroquinolones and injectable aminoglycoside resistant, then this TB is known as XDR TB. So can we say rifampicin and isoniazid is given? Kanamycin is given here, which is injectable aminoglycoside, and fluoroquinolone is given. So what is the answer? The answer for this question is C, extensively drug resistant TB, which is also known as XDR TB. समझ गए कहानी? Good. Next is a 25-year-old male presented to emergency with head trauma due to road traffic accident. In hospital, the patient developed seizures. The emergency CT scan revealed widespread cerebral edema. So the patient is having cerebral edema. Which of the following diuretic of choice is for cerebral edema in this patient? So yes, the answer for this question is mannitol. Okay? The answer for this question is mannitol. Here only I will give you the complete list of the drugs diuretic of choice in edema. Let's write that diuretic of choice in edema. Remember, edema occurs in organ failure, like heart failure. Remember, in heart failure, you see two types of edema. One is pulmonary edema and anasarca, whole body edema, या फिर in initial terms, initial stages, you will find pedal edema. The second one we will write is renal failure. Renal failure like CKD, chronic kidney disease, like nephrotic syndrome, any cause. Here you will find periorbital edema. You will find which edema? Periorbital edema. Third one, let's write liver failure or cirrhosis. Here which edema you find? Here you find ascites. Which edema you find? Abdominal edema, ascites. And lastly, we will write head injury. In head injury, there is increase in intracranial pressure. So here you will find cerebral edema. Okay? These are the various causes of edema. So let's see the diuretic of choice. In these two conditions, the drug of choice is loop diuretic, like furosemide. Here, the drug of choice is spironolactone. And here, the drug of choice is mannitol. Remember, mannitol is an osmotic diuretic. Okay? Spironolactone is an aldosterone antagonist. Okay? Now, if the edema is not controlled, you start with furosemide. In cases of refractory edema to spironolactone and mannitol, you add a drug furosemide, but the initial drug of choice is mannitol. Agreed? Now one point we will write. Okay? So remember this part. This diagram is very important for you. Okay? Chalo, next question. So the answer for our question was mannitol. It is not spironolactone, furosemide. No, they are not the initial drug of choice. Initial drug of choice is mannitol. Next is a 28-year-old male went to Ladakh. He developed shortness of breath. Which of the following drug would you like to use in the treatment of mountain sickness? Remember, the drug of choice for mountain sickness is carbonic anhydrase inhibitors like acetazolamide. So when you suddenly go into the mountain, you will stop breathing because of less oxygen and more carbon dioxide. Why we give acetazolamide? Because acetazolamide causes metabolic acidosis. It means it increases H plus ion in blood. This H plus ions in blood stimulates chemoreceptor. And this chemoreceptor increases breathing. It increases breathing. And what happens in mountain sickness? The main problem in mountain sickness is the patient respiratory depression occurs. Patient doesn't breathe. So why we give acetazolamide? Because it increases the breathing of the patient. Okay, understood? Let's move. A female patient presented with green vaginal discharge with clue cells with whiff test positive. Can you tell me what is the diagnosis? The diagnosis of clue cells and whiff test positive is the female is suffering from bacterial vaginosis, which is caused by Gardnerella vaginalis. And for the treatment of Gardnerella vaginalis, the drug of choice is metronidazole. The drug of choice is metronidazole. Okay, very good. So the answer is metronidazole. So metronidazole is given for which vaginal discharge? Bacterial. Remember, metronidazole is given in which sexually transmitted disease? One is bacterial vaginosis. It is also given in Trichomonas vaginalis infection. Here the drug of choice is metronidazole. Where doxycycline is given? Doxycycline is given as LGV, lymphogranuloma venerum, which is caused by chlamydia. Okay? Ceftriaxone is a drug of choice for gonorrhea. Again, another sexually transmitted disease. Fluconazole, drug of choice for fungal infection like candidiasis. Candidiasis also causes vaginal discharge. So now you know that in which sexually transmitted disease, if a female is having vaginal discharge, which drug to be used? Okay, which drug to be used? Now, a young boy was presented to hospital with complaints of few episodes of fast blinking. That means the patient is having blinking and staring at something for around 20 seconds. The EEG shows 3 Hz spike and wave pattern. Can you tell me what is the diagnosis? In EEG, there is spikes, 3 Hz wave spike. Can we say our neurons will be firing? Neurons are firing. And 3 Hz wave spike pattern is the typical diagnosis of which scissors. Scissor means abnormal firing of neuron. This is the typical diagnosis of absent scissors. So we discussed this in class that absent scissor, it is only diagnosed on the basis of EEG, and EEG shows typical 3 Hz wave spike pattern. And there are 3 drugs which have been approved for the treatment of absent scissors. The drug of choice for absent scissor is ethosuximide, but the other 2 drugs is sodium valproate or simply valproate. Valproate is given in all scissors, remember, and lamotrigine. Lamotrigine and valproate are given in all types of scissors. So if any scissor comes, if you will find this option valproate or lamotrigine, you straight away mark that answer. So the answer is sodium valproate. Okay? Absent scissors. You are absolutely right. You all are absolutely right. Next is a professor in medical college is teaching students about adverse effect of a drug. Which of the following drug causes gynecomastia in men and menstrual irregularities in female? So remember, the drugs which causes gynecomastia are, make a mnemonic, disco. The drug which causes gynecomastia are disco. So let's write. First is digoxin, heart failure wala drug. Isoniazid, one anti-tubercular drug. Spironolactone, one diuretic. Cimetidine, ketoconazole, and omeprazole. These are the drugs which causes gynecomastia in males. So our answer is spironolactone. So this is a very famous mnemonic which I teach you in class also. Very good, Sayani Chakravarti, EVL, you remember that thing. So why spironolactone causes gynecomastia? Because spironolactones block testosterone receptor. Hence it causes gynecomastia. It also blocks estrogen receptor. Hence it causes menstrual irregularities in females. Now sometimes because it blocks testosterone receptor, if you want to block testosterone receptor in female, spironolactone is given for the treatment of hirsutism, because hirsutism occurs because of increase in testosterone level in females. So sometimes spironolactone is given for the treatment of hirsutism in female. Hirsutism is seen in which disease in females? PCOD, polycystic ovarian disease. Okay? It is also given for the treatment of hirsutism. Let's come to next question. What is the mechanism of TPA? TPA stands for tissue plasminogen activator. And these drugs, they end with the word tiplase. Can you name some drug? Can you name some drug that ends with the word tiplase? L-tiplase, retiplase, tenectiplase. Heard about these drugs? Now let's see what is the action of TPA. In our blood, we have a molecule known as plasminogen. TPA converts plasminogen into plasmin. That is why it is known as tissue plasminogen activator. Plasmin is the active form. What plasmin does? Suppose there is fibrin deposited here. This plasmin degrades fibrin. So it removes fibrin or lyse fibrin. It degrades. That is why these drugs are known as fibrinolytics. What we call these drugs as? We call these drugs as fibrinolytics because they will remove the fibrin which is already deposited. Okay. So what is the answer? The answer is they promote fibrinolysis. They promote fibrinolysis. Fibrinolysis are given in the treatment of MI and stroke. Which MI? STEMI, ST elevated MI and stroke. They are given in the treatment of MI and stroke because if blood vessel remains blocked, the patient will die. You have to remove fibrin very rapidly. Okay? Very rapidly you have to remove them. Next is, which of the following drug would you omit from the prescription of a patient with XDR-TB? Remember XDR-TB? In pregnancy. Remember in pregnancy, aminoglycosides are contraindicated because they produce fetal ototoxicity. So which anti-tubercular drug we don't give in pregnancy? Aminoglycoside. Can you tell me a mnemonic? I have just told you about aminoglycosides. 4 aminoglycoside, who will tell me? I have just told you. Can you tell me the 4 aminoglycoside I have just told you which are given in TB? Streptomycin, absolutely contraindicated in pregnancy. Amikacin, capreomycin and kanamycin. SAC. So SAC drug, aminoglycoside, not given in pregnancy. So the answer is kanamycin. ठीक है, आगे बढ़ते हैं. A 52-year-old patient with cardiac valvular disease was started on long-term warfarin therapy What should be the target INR value? Now this is a tricky question. First I will tell you the answer. First I will tell you the guidelines. After seeing the guideline, you all will choose the correct answer. I am not telling you the correct answer right now. So what is the use of warfarin? Warfarin is an anticoagulant drug. It will prevent the deposition of fibrin so that blood vessel will not get blocked. So uses of warfarin is according to INR. INR indication. So it's a tricky question. You have to choose the correct answer. Let's see how we can choose. If the INR is 2 to 2.5, warfarin is given for prophylaxis of deep venous thrombosis. Deep venous thrombosis also causes pulmonary embolism because there is excessive fibrin deposition in leg veins. INR 2 to 3. INR 2 to 3. It is given for treatment of DVT. Okay? After knee or hip surgery, because after knee or hip surgery, the patient becomes immobile. The patient will have higher risk of developing DVT. You'll write 2.5 to 3.5. You'll write cardiac valve replacement or prosthetic heart valves. Now tell me what is the correct answer. With which answer would you like to go? Would you like to go with C or D? Would you like to go with C or D? What should be the answer? So it's a tricky one. Would you like to go beyond 3.5? Would you like to go? We will never go beyond 3.5. We will never go beyond 3.5. So yes, you will go by the answer C. Okay? So you will go by the answer C. Because 2.5 to 3.5 range will come here. Okay? So this is actually the correct answer, 2.5 to 3.5. Okay? Okay? 2.5. Now, a 50-year-old female presented to oncologist with breast lump. No. MK58 never. 1 to 2 never. Because prosthetic heart valve is a very dangerous condition. Here you have to give lifelong warfarin. The blood should remain thin because the prosthetic heart valve, they activate clotting factor continuously. You have to give the highest possible dose of warfarin in this case. More the dose of warfarin, more the INR the patient will have. Okay, what is INR? We will discuss later on. But remember, more the dose of warfarin, greater the INR, international normalized ratio. Yes, all questions are straight from notes. On examination and investigation, breast cancer was diagnosed. Okay, chalo theek hai. Echocardiography of this patient shows ejection fraction of 25. That means the patient is going into heart failure. The patient is having heart damage. Okay? Which of the following drug would you avoid in this patient? So tell me, anyone who can remember this, remember. So before coming to this drug, I will tell you the side effect of anti-cancer drug. Just a moment. Let me tell you the side effect of anti-cancer drug. Just a moment. Let me put a new slide for you people. Just a moment, sorry. Just a second. So that you will understand it much better. So what are the side effects of anti-cancer drug? This slide is very important. Okay. So let's make a human. And after that, you will tell me the answer for this question. Okay? So first is cerebellar damage. Cerebellar damage. Cerebellar damage means nystagmus, ataxia. It is caused by an anti-cancer drug, cytarabine. Then ototoxicity. Ototoxicity is by cisplatin and cyclophosphamide. Okay, I am giving you a very beautiful list of side effect of all anti-cancer drug. Lungs. In lungs, you will write pulmonary fibrosis. Two anti-cancer drugs we will write bleomycin and busulfan. Bleomycin and busulfan. Then you will write heart. On heart you will write cardiotoxicity. That is heart failure. And these drugs, they end with the word rubicin. Rubicin means red color drug, like doxorubicin, epirubicin. Any drug that ends with the word rubicin will damage heart. Idarubicin, etc. Doxorubicin is also known as adriamycin. Another name of doxorubicin is adriamycin. Then you will write kidney. In kidney, you will write nephrotoxicity. Nephrotoxicity, platinum wale compounds, cisplatin, carboplatin are nephrotoxic. Bladder, urinary bladder, you will write cyclophosphamide. And its brother, ifosfamide. If you remember this diagram which I have told you in the class notes as well, you could have marked all the answer correctly. Okay. Lastly, one liver भी बना लेते हैं. Hepatotoxicity, methotrexate. ठीक है. Other, you can write diarrhea. Although this part I have not made in the diagram, but I have made you write separately. Irinotecan. Chalo. ठीक है. Now tell me the answer. Tell me the answer. Who will tell me the correct answer? Which drug would you not give in this patient? What is the answer? What is the answer for this question? Question number 19. What is the correct answer? The answer is rubicin wale drug. Rubicin wale drug, they are cardiotoxic. Okay, now you know the answer. Irinotecan, diarrhea. Cyclophosphamide, bladder. Bladder means I have not made you write hemorrhagic cystitis. Write this side effect of bladder. Hemorrhagic cystitis. With bladder you will write hemorrhagic cystitis. With methotrexate, liver, hepatotoxic. Plus it is an antifolate drug also. So antifolate drug, we know this. So epirubicin is the answer for our question. Epirubicin. Next is, which of the following drug is used for MTP? MTP is medical termination of pregnancy. In simple words, it is also known as medical abortion. So what is the guidelines of India? What says? The guidelines of India says that, which Indian guideline, the government has made the guideline that if a female comes to you on day 1, we give mifepristone 200 milligram oral, because mifepristone is an anti-progestin. It will kill the fetus. Then after 48 hours on day 3, give misoprostol. Misoprostol is prostaglandin E1 analog. Prostaglandin E1 analog, it contracts uterus. It contracts uterus. Because of this reason, it will expel fetus out of the body. So, mifepristone is given to kill fetus because progesterone hormone is required for pregnancy. It is anti-progestin. Misoprostol contract uterus, it will expel the fetus. So we give misoprostol up to 49 days of gestation. We give 400 microgram, either orally or vaginally, and up to 63 days of abortion, we give double the dose, 800 micrograms. Up to 49 days of gestation, 400 microgram. Up to 63 days of gestation, 800 microgram. Beyond 63 days, we don't give mifepristone. So what is the answer for our question? Who will tell me the correct answer now? Who will tell me the correct answer? So now we all know the correct answer is, I think they both options are right actually. So A and B, because of, I think there is some mistake. So the answer is mifepristone. So you can mark A or B. We know the answer. Oh, sorry. No. I'm really sorry. I have mistaken. Sorry. What is the answer? Yes, the answer is mifepristone followed by misoprostol. Okay, in B it was methotrexate written. Okay, so the answer is A. Okay, I got confused. A. Yes, MK58, you are absolutely right. Okay, second last question. Which of the following is an adverse effect of orlistat? Now, what is this orlistat? Orlistat is what is orlistat? Orlistat is oral lipase. Stat मतलब blocker or inhibitor. Orlistat is an oral lipase inhibitor. It means this orlistat inhibit digestion and breakdown of fat in GIT. So you know that to break down fat so that fats gets absorbed into blood, we need lipase enzyme. If you will block lipase enzyme, the fats will not be broken down. So can we say the fats will get less absorbed? So it will decrease fat absorption. If you will eat something and fats are not absorbed, what is the use of orlistat? The use of orlistat is it is used as an anti-obesity drug. Because the fats will not get absorbed, you will become thin. So what is the use of orlistat? Anti-obesity drug. So what will be the side effect? The side effect is the fats will be excreted out in feces. The fats will be excreted out in feces. This is known as steatorrhea. The fats will be excreted out in, just a second. The fats will be excreted out in, yes, anti-obesity drug, which is also known as anorectic drug. But here I will not write anorectic because anorectic drugs, they act at a level of brain. Orlistat acts at a level of GIT. So it is anti-obesity drug. Okay? So it causes weight loss. Anti-obesity drug causes weight loss. Okay? So simple. Good. Let's come to the last question. Which of the following statements about antipsychotic drug aripiprazole is most appropriate? Okay. So first I will tell you the complete list of antipsychotic drug. This is how you will identify antipsychotic drug. These are atypical antipsychotics, newer antipsychotic drug. There are certain older antipsychotics also, which I have left for a moment. Otherwise the session will increase. So first is antipsychotic, which are 5-HT2 antagonist and D2 antagonist. Remember, 5-HT2 antagonist, they increase appetite. Their side effect is they increase appetite. And D2 antagonists, they cause extrapyramidal symptoms. If you block dopamine in basal ganglia, it causes extrapyramidal symptoms like Parkinson's disease. Okay? So any drug which is a 5-HT2 antagonist and D2 antagonist will end with the word pene and don. So clozapine, olanzapine, zoltipine, acinapine, quetiapine. So you can see pene, don, ziprasidone, risperidone, elaperidone, citindol, paliperidone. So this is how you have to identify these drugs. Either they will end with the word pene or they will end with the word don. The second drug we are having is D2 partial agonist. So D2 partial agonist, it is not an antagonist, it is partial agonist. So it will have less EPS. And 5-HT1A partial agonist, less increase in appetite, remember, causes weight gain. If you will eat more, it will lead to weight gain. So it will have less risk of weight gain. Because these drugs are not antagonists, these drugs are rather partial agonist. Because they are partial agonists, see the name Pipra. Pipra means partial agonist. Piprazole word will come. Aripiprazole, brexpiprazole. Aripiprazole. So remember, antagonist is a complete blocker. If you block 5-HT2 serotonin receptor, you will eat more. Serotonin normally suppress our appetite. D2 is dopamine. If you will block dopamine receptor, it will lead to Parkinson's disease, which is known as extrapyramidal symptom. But these drugs are partial agonist. Partial agonist will have less risk of causing extrapyramidal symptom and less risk of increasing weight gain. Okay? Then D2 and D3 antagonists, these drugs they end with the word sulpiride. So can you tell me what is their side effect? Their side effect is high risk of EPS, extrapyramidal symptoms. Okay? That is sulpiride, levosulpiride and amisulpiride. And lastly, 5-HT2 inverse agonist. This drug has an advantage. This drug does not act on dopamine receptor. No risk of EPS. EPS is extrapyramidal symptom like Parkinson's disease, which occurs because of dopamine blockage in our brain. So inverse agonist 5-HT2A, inverse agonist serotonin, inverse agonist 5-HT2 is a receptor of serotonin. 5-HT2 inverse agonist serotonin, inverse agonist pimavanserin. So can you tell me which drug will be the safest drug in Parkinson's disease? Which drug does not cause Parkinson's disease? This was a question which was previously asked. So the drug which does not act on dopamine receptor will have no risk of Parkinson's disease, pimavanserin. But our question was asking about aripiprazole. Our question is about aripiprazole. So read about aripiprazole from here and tell me the answer now. Read about aripiprazole first. D2 partial agonist, 5-HT1A partial agonist, piprazole. Because it is not an antagonist, hence less risk of Parkinson's disease, EPS. Because it is a partial agonist, it is less risk of weight gain. Now tell me the answer for this question. Who will tell me the correct answer now? Who will tell me the correct answer for this question? First tell me, it is a partial agonist or a complete antagonist? See, these words are given. So tell me first what it is. It is a partial agonist. Piprazole, partial agonist. Name is telling you the answer. Second, it will have more risk of extrapyramidal symptom or less risk? Less risk. So it will have less risk of causing extrapyramidal symptoms and less weight gain. as compared to, because antagonist or complete blocker will have more risk. So the answer for our question is A. A is the correct answer. Okay, so the answer for our question is A. Okay, partial agonist, less extrapyramidal symptom, less weight gain. Okay, so remember this diagram. This diagram I teach you in the class also, how to remember the names of antipsychotic drug. There is a trick, very beautiful trick, which we never forget. If we remember this trick, we will never forget it. Okay, so this is all about the certain questions, 2022 questions which have been asked in pharmacology exam. Pharma is a big subject and it's a high yielding subject, so you can, if you read the notes properly, you can mark all the correct answers. Okay, so thank you very much. I hope you all have given your best. So best wishes to each and everyone. So if you have any doubts, you can even ask me out here. Thank you, Sayani. Thank you, Kushavasti. If you have any doubt, you can ask me. You can tag me on Facebook as well. Okay. So best wishes everyone. Keep studying. Why there is psychosis in Parkinson's as dopamine is decreased? The reason is in Parkinson disease, although the dopamine is reduced, but certain other neurotransmitter can be increased. Serotonin level can be increased. Glutamate level can increase. Any amine neurotransmitter can lead to psychosis. So there is rather increase in serotonin level in Parkinson disease, which leads to psychosis. Although the dopamine is reduced, but serotonin level increases. The reason is the dopamine is an inhibitory neurotransmitter. That is why the excitatory neurotransmitter level may increase. Okay. So we'll close our session out here. You can ask all your doubts in the respective forum. So thank you very much. Keep reading, keep your head down, always be focused and keep learning. Okay, no one can stop you then.